Okay, guys, I have discussion C for you, and we're discussing stroke and cognitive decline, long term effects of a stroke causing cognitive decline. So, that being said, we'll get started. So, here we go. The text discusses research findings from the Center for Healthy Brain Aging, or CEBA, which highlights that older adults who experience a stroke for the first time uh, face significant immediate long-term cognitive decline. A stroke, a leading cause of disability and dementia worldwide, occurs when blood flow to the brain is blocked or reduced, damaging brain cells. The study, published in JAMA Network Open, reveals that over a third of stroke survivors experience notable defects in cognitive abilities, such as thinking, memory, and decision making, with some developing vascular dementia. This research underscores the profound and lasting impact of stroke on cognitive health. Okay. Page 1 down. Okay. The long-term effects of stroke on cognitive health can be profound and varied. Stroke survivors often experience cognitive impairments, which may include difficulties with memory, attention, problem solving, and decision making. These challenges can significantly impact daily life and overall quality of life. In some cases, stroke survivors may develop vascular dementia, a condition characterized by a decline in cognitive function due to reduced blood flow to the brain. Okay, then you go down. The severity and type of cognitive effects depend on the location and the extent of brain damage caused by the stroke. For example, a stroke in the left side of the brain may lead to issues with language and abstract thinking. Okay. Next page. While a stroke in the right side may affect spatial awareness and memory, rehabilitation and therapy can help mitigate some of these effects, but recovery varies widely among individuals. Common cognitive impairments after a stroke include memory loss. Stroke survivors often struggle with short-term memory and episodic memory, making it difficult to recall recent events or details. And then you've got executive dysfunction, changes in planning, organizing, and decision making are frequent, especially if the frontal lobe is affected. Attention defects, difficulty concentrating or maintaining focus is a common issue. Okay. Language problems. Some survivors experience amnesia, which affects their ability to understand and or produce language. Spatial neglect. This involves ignoring one side of the visual field, often due to damage in the right hemisphere of the brain. Okay, problem solving difficulties. Survivors may find it hard to process information or reason effectively. Okay, these impairments can vary depending on the location and severity of the stroke. Rehabilitation and therapy can address these challenges and improve cognitive function over time. Okay, then there's let me know if you'd like to explore recovery strategies or therapies. The main risk factors for having a stroke. Okay, next page. Okay, guys, I'm going to go through the risk factors now for a person to have a stroke. So, first one is high blood pressure. This is the leading cause of a stroke, as it can damage blood vessels and lead to blockages or ruptures. Diabetes, high blood sugar levels can damage blood vessels and increase the risk of stroke. Okay, high cholesterol, excess cholesterol can lead to plaque buildup in arteries, restricting blood flow to the brain. Heart disease, conditions like arterial fibrillation or heart valve defects can cause blood clots that may lead to a stroke. Smoking damages blood vessels and increases the likelihood of a clot formation. Then you have obesity and physical activity. These factors contribute to other conditions like high blood pressure. Okay. Diabetes, which are stroke risks factors. Okay, excessive alcohol consumption, drinking too much alcohol can raise blood pressure and increase risk of stroke. Family history and age. A family history of stroke or being over age 55 increases the likelihood of experiencing a stroke. Many of these risk factors can be managed through lifestyle changes and medical interventions. Let me know if you'd like tips on prevention or more details about any of these factors. Okay, guys, I'm going to take a break. I'll be back on for D&D later. For now, Gator Wellness, take care, folks. Have a good evening. I'll be back on with D&D later tonight. So I will see everybody later tonight for 2 more shows. For now, Gator Wellness, take care.